Hey everybody, it's Fahim here. Welcome by this video on Medlearn or by Medlearn. And before we always get into the video, please subscribe, like and share. Your support is very important and I want to thank all my supporters and followers. Really appreciate it. This is a video where we are going to be talking about how to select a scope of practice. So if you're a pharmacist, if you're a nurse, or perhaps you're a paramedic and you're looking to do your prescribing course, then this is important for you. So anyone that is regulated and is allowed to undertake a prescribing course, this is a good video for you, so pay attention. So how do you select your scope of practice? I think the first thing is to identify what is a scope of practice. And how I'm going to explain that to you is by telling you what is not a scope of practice. So what is not? What is the not? Right. A scope of practice is not a condition or is not an area where you are diagnosing and treating that you enjoy. Okay? Let me explain to you. It's not something that I like diabetes, so I'll choose diabetes. No. That's important. So it's not something you, and enjoy is the wrong word, it's not something you want to do. So it's not something I want to do. I explained to you. So it's not something I want to do. Oh, I enjoy cancer. I want my scope of practice to be in cancer. No. It is not general. Let's not worry about the spelling too much. It's not general. It is not that I will decide my scope of practice to be minor illnesses. That is a huge topic. So these are the two things that you have to remember. Now, what is it? We can think of a scope of practice as an area. So it's an area in medicine, it's an area or a topic that you have experience in. So it's an area, it's a topic that you have experience in. When I mean by experience, I mean you are actively involved in diagnosing and treating this area. So let's take an example. If you're a community pharmacist, you might say, okay, I'm working in a pharmacy. What do I actively see? What do I actively treat? So you see pharmacy first conditions, so ENT related, ENT. You see patients who have sinusitis, who have sore throats or ear problems. So you might say, actually, my scope of practice is going to be the diagnosis and management of commonly seen ENT related conditions. So you have to, one, define. So you have to define, and how you choose your area. For example, let's say ENT. Okay. You can then choose conditions within ENT, so make it specific. And you might say, actually, as a pharmacist, I'll do tonsillitis, I'll do otitis externa, I'll do sinusitis. And then also choose the age range, so the demographics. So you could say, my scope of practice is the diagnosis and management of adults and children who present with tonsillitis. And then you might add with no comorbidities or excluding pregnancy. That is a scope of practice. Why? Because as a pharmacist, you can demonstrate that you are actively involved. Let's say we get patients over the counter and they have a sore throat. You take a history, meaning you interview the patient. May not be the best interview, but you interview the patient. You understand their signs, symptoms, you understand their information. You then recommend a product. And that might be paracetamol, that might be ibuprofen, that might be Difflam spray, that might be a lozenge. Or you might say, actually, you have exudate or white spots behind the tonsils, you've got a fever, I'm going to refer you to hospital. I'm going to refer you to the GP because you have an infection. Or you may do a pharmacy first consultation. And then you might do a review. Can you see you're fully involved in that process? Imagine I say I like to do diabetes. I want to do diabetes. Okay, what experience do you have in diabetes? I measure their glucose levels. Okay, I know, and this is not me actually saying that's what I know. I mean, I know diabetes quite well, but I'm just explaining to you, okay, what else do I know? I like diabetes because I think it's easy, and there's type 1 and type 2, and you just check their sugar level. And what else do I do in a pharmacy? I will also, I will if there's someone who I think is diabetic, I'll refer to the GP. But diabetes is a huge condition, because we know with diabetes, you're going to have issues with your lipids. We know there's a possibility that you might even be hypertensive. We know with diabetes that there's that risk of atherosclerosis, the risk of heart damage. There are so many things that get involved. We know that there's going to be some obesity. That's why they also call diabetes metabolic syndrome, because, well, type 2 diabetes, these are the things that can happen. So it's not as simple as just saying, oh, I enjoy diabetes. Even pharmacists say to me, hypertension. I want to do hypertension. How much are you actively involved in hypertension? Are you actively diagnosing? Are you actively involved with your doctor and saying, look, start him on an ACE inhibitor, no, change the ACE inhibitor? Are you checking for end organ damage? Unlikely. It's not that you're not capable, unlikely. Nurses, on the other hand, nurses actively work with patients and deal with chronic conditions. So they might choose asthma. They might be a specialist nurse. They might do mental health. So you've got to ask yourself, one, do I know the condition inside out? If I was to be asked by someone, how do I diagnose this condition? How do I manage this condition? How do I treat this condition? What are the signs, symptoms? What are the red flags? If I can answer it, that can be your scope of practice, but define it. Write down the condition. For example, I will diagnose respiratory infections, upper and lower, in what age range and which ones, bronchitis, pneumonia. That's what you have to do. So I hope you found this video useful. Whether you're a pharmacist, whether you're a nurse, you're a paramedic or a physio, defining your scope of practice is important. We have plenty of videos and information on Medlearn website. Have a wonderful, wonderful whatever you're doing, and thank you for watching. Hey everybody, it's Fahim here. Welcome by this video on Medlearn, or by Medlearn. And before we always get into the video, please subscribe, like and share. Your support is very important, and I want to thank all my supporters and followers. Really appreciate it.